All righty, so today, we are really ready to get things going. And you can tell how anxious I am by the sound of my voice. I love what she has put in here. I do want to remind you again about the Crisis Talk and the Crisis Talk page, because it is filled with a tremendous amount of useful information. Just accessing the talk.crisisnow.com will give you a ton of material. You can go both backwards and forward on this page. You can look at previous sessions. You can look ahead to see who's going to be coming up next. And I'll be speaking more about it a little bit later, but we're also looking forward to future sessions and how they will be. I would tell you also, look in your chat box as the session's going along, because Karen and Chris are very good about putting messages in there and links so that you can connect with all of the things that come up from this particular session and from within this site. So I think we have reached it. We're close to coming in. I want to go through a couple of things. And again, my welcoming again to everyone. I'm Dr. Brian Sims. I'm with Nascar, and I will be your host today. And I am thrilled, and you can see how excited I am because I'm ready to kind of jump into the agenda. But I just want to make sure that we are welcoming all of you, but also to make you aware of all of the wonderful things that are going on from within this site. This first slide that you see lists our top 5. And if you notice, it's a little different in terms of its makeup. But it still highlights the most important information. And as you can see from this, our #1 still continues to be the youth edition that took place with Dr. Shaw and with Dr. Everett. So we are really happy to see how much increase we're seeing in the viewership of the crisis jams, and we're encouraging people to continue to move forward and continue to talk to others about connecting up with the crisis jam and becoming a part of this. So let's go to the next slide, please. All righty, and as I featured, we have a number of episodes coming up, and I do want to go back and just point out that this episode, is actually episode 121. So we are really moving forward and excited about this. And as things move further forward, one of our further episodes, when we talk about in July, on July 12th of this year, we are going to celebrate 1 year of the Crisis Jam. And we are going to be honored at that point to have with us Monica Johnson, who's with Samsa and heading up the 988 effort. And we're really looking forward to that day coming. So next slide, please. Now, this slide highlights a New York Times article, and it kind of goes along the lines of what we're going to be speaking about today when we're talking about community mobile response and how it works, because many of you have said to us that one of the biggest problems you have is boarding in the ERs and so forth. And this is kind of a reminder article to let us know that hospitalizations for pediatric age group have seen tremendous increases in suicidal behavior across a myriad of hospital systems. So it really kind of highlights the need for us to take a look at our ER systems and find alternative measures to prevent the boarding, to be able to get these kids into the needed services. So next slide, please. This is a slide of the reminder that the Samsa store does have offerings that are free of charge, up to 326 or so of them that are able to be placed and given to you free, so we can spread the message with regards to 988. We've now gone into implementation. We're now putting it into practice. We need to get the word out to others. So please feel free, use this site as you see fit and get these things, the magnets, the posters, the other types of material. What you'll find is that they'll be extremely helpful in spreading the word. Next slide, please. And again, a reminder to everyone about the availability of the Jam Sessions t-shirts. And it used to be a t-shirt thing, but now we're actually talking about t-shirts, long sleeve shirts, hoodies, and hats. So any of you that would like to go in, just go into the Crisis Jam, and you can go through the link that's been placed in the chat box, and you can purchase it, or you can be a host, a trivia seat host. And if you're a trivia hot seat host, regardless of the response, you're going to get a t-shirt free of charge. So we look forward to that. And speaking of Trivia Hot Seat, we're going to change things around just a tad, and we're going to bring in the hot seat right at this point. So I'd like to bring on Vic Armstrong, very good friend, into this on. And Vic, welcome, sir. Welcome.
Thank you, sir.
Oh, man, it is great to see you and great to hear you. So I'm putting you up here and just letting everybody know this is not Vic's only step. He will be seen a little bit later on because we're going to call on him again. But we're calling on you this time, sir, for the Trivia Hot Seat question of today.
All
and
right.
It reads out in April of 2021, the Center for Law and Social Policy, which is also called CLASP, published a report calling for an investment to decriminalize mental health, which focused on eliminating negative narratives, specifically for young Black people with mental health conditions. So the question posed is, which core emergency service was the primary subject of the report to better respond to mental health and social crisis? So Vic, you know the rules there. You can choose to answer it on your own. You can go with the audience. But while you are making that decision, we're asking for the audience to please place your responses in the to the poll so that we can gather that up for Vic. So Vic, which way would you like to go, sir?
I want to see the audience responses first. I have my own thoughts, but I do want to see where the audience is.
Okay, well, there it is. Well, we
Yep.
have nearly a 70% response on B and just kind of scattered on the others.
Yeah. They are right where I was, so I'm going to go with B. That is my final answer.
All right, well, I love how quick that one came through there, sir. And let's go ahead and show the response. And you are absolutely correct, sir. And the audience on top of things as usual. Youth Mobile Response Services called for states and communities to deploy the researchers and to structure to effectively and equitably engage communities of color as an alternative to law enforcement. We'll talk a lot more about that later on, but clearly this is something that is very, very important to our movement forward. And we're so looking forward to where things are going. Vic, thank you so much for coming in and being a part of it. I don't know how the t-shirt thing works out for you, but just get in touch with Karen and maybe you can get a hoodie this time or a hat or something of that nature. But thank you, sir. And we will be talking to you in just a little bit, okay? Now, I want to move next to a quote for today. And the quote comes from the Center for Law and Social Policy. And it reads, Black communities need transformational change, bold and radical investments in systems that increase safety, healing opportunities, and programs that address the historical and intergenerational trauma caused by systemic racism in general, and in our helping systems specifically. Such a powerful mode to move us in the direction of where we need to be going. Next slide, please. And we have made it now to our keynote session for this morning. And we are honored this morning to have Cosette Ayele as our speaker for this morning. She's the organizing director with Raheem. And I'm just going to turn it over to you, Cosette. Please proceed.
Thanks so much, Brian. And also thanks for having me. I've been attending these crisis jams for a while, so I'm really excited to talk with everyone about why community mobile response works and really honing in this conversation on why we need to decouple crisis response from government systems. Next slide, please. So before I talk about what we do, I kind of want to talk a little bit about who we are. So our executive director, Brandon Anderson, founded Raheem in 2017 to be a reporting service where people could share their experiences with police violence and get access to people in their community who could support them in attaining justice. Brandon was and still is passionate about ending police violence, especially after his best friend and partner was murdered by the police during a routine traffic stop. Everyone on our team is compassionate and passionate about this work of supporting communities that are creating alternative responses, because all of us have lived experience with police violence and violence against Black and queer people. So a bit about myself, I'm Cosette. I'm the organizing director at Raheem, and I'm actually born and raised and based in Chicago on the South Side. I come to this work as a person who has survived police violence, sexual violence, and mental health crises. I organized my very first vigil in 2015 when a friend from my high school, Quintonio LeGrier, was killed by police after calling 911 for help 3 times and not receiving any help during his mental health crisis. At that time, they also killed Betty Jones, who answered the door. Since then, I've been working with the organizers that actually did the work to help make spaces like this possible. I think it's really important that we acknowledge how mental crisis teams became popularized in the first place. And it's because of the Black Lives Matter movement and later the Defund the Police initiatives that demanded to see the communities that have been historically disinvested in have mental health centers and have care providers. Many of you, I'm sure, have seen campaigns to fire cops that have killed Black and Brown people. And these uprisings were rooted in what we call generative abolition. Next slide, please. Generative abolition is about creating something, and it's about replacing a harmful system. Local governments spend more than $200 billion on policing and even more billions of dollars to settle police misconduct, and they still don't keep people safe. I know that this space often talks about not having police as part of mental health crisis responses, but it's really deeper than that. Many of the experiences of violence in poor, Black, Indigenous, Brown, and queer communities happen due to lack of investment in care overall. These communities are met with incarceration when their crisis isn't deemed a mental health crisis. And of course, from our conversations, we know even when it is, they still are deemed unable to get and access care. So, and then when we want to be heard in circles, sometimes like this, we're tone policed, ridiculed, and even silenced to being radicals for knowing that we often keep us safer than police do. I really think that we have to change the way we respond to all crises in order to create an ecosystem of care overall. Next slide, please. That's why we convened the Patch Network. Since joining Raheem, I've talked to community organizations, service providers, advocates, organizers, and crisis teams about their work to learn about them and what they need in order to increase care in their communities. The Patch Network is a collective of groups and organizations that are working in their respective communities to build responses to crises outside of policing. This does include mental health crises, but it also groups are mobilizing around domestic violence, intimate partner violence, sexual violence, businesses that are allied and have our values, even will call crisis teams in the cases of theft, harassment of people that are unhoused, roommate disputes, eviction prevention, and harm reduction for people that are struggling with substance use, cop watching for police violence, and even some violence interrupters that address and arrive for community care after a shooting or interpersonal dispute. What we do is we host the quarterly meetings to focus on different topics related to crisis response, and we provide capacity building support for orgs in areas that are overtly policed and underinvested in. We work to build the confidence, expand the skills, and foster relationships needed to expand the number of people equipped to effectively and sustainably deliver community crisis care nationwide. And our hope is that we can double the number of community crisis teams, or CCRTs, in the US by 2025. Next slide, please. So we've been talking a lot about mobile crisis teams in this group. So you may ask and wonder, well, how are CCRTs and the Patch Network different? Here's a bit how. Like I mentioned earlier, they're rooted in abolition, in support of those that have been historically harmed by policing and its systems. They have independent hotline numbers, often not connected to 911 or 988, though they are considering what it would mean in order to be connected to 988. But they really want to have no fear of a caller, no fear from a caller being dispatched to police. They also rely on community involvement and trust. The belief that really anyone can respond to a crisis if they have enough training, and essentially you can rely on your neighbor for help in a crisis. This is kind of based off of a lot of the work that Mia Mingus has done around pod mapping. As you can see in this image, pod mapping is centered around the belief that you are not alone and that you have a community and that there are people in your community that you can reach out to for help, and they're often more available and more compassionate and caring because they know you. And then lastly, they really emphasize safety of information because there would be no reporting requirements. And this is incredibly important for people that are undocumented or formerly incarcerated and don't want to be criminalized just because they need help. Next slide, please. So you may ask also, how do we plug in specifically? So Raheem isn't an organization that is a CCRT. However, we provide capacity building services and technology for CCRTs, specifically in the area of dispatching through our app called Patch. Patch is an app that helps organizations coordinate their responses. It's essentially a CAD system or computer-assisted dispatch system that CCRTs can use for free to help them prioritize requests for help, figure out who's available, follow up in an end-to-end encrypted chat, and also capture detailed response data that helps them apply for grants. Next slide, please. And so I want to highlight some of our partners in this work before I move on, because they're the reason why we're here today. So some of them use our dispatching app Patch, but some of them are still in the process of figuring out their strategy for community crisis response and also fundraising so that they can be fully sustainable. But some of our partners are here: Cambridge Heart, Dasher, the DC Safety Squad, the Coalition for Re-envisioning Our Safety, MH First, and the Motor City Mobile Wellness. All of these groups deliver culturally competent care to people with unarmed community members that are trained to help. This is a powerful, proven, and local solutions that are emerging across the country to meet people's urgent needs without involving police. Our partners is why we come to this work and really have shown to us what community response is and what it entails. But I want to tell you even a little bit more about that. Next slide, please. So just to dig a bit deeper into some key points about CCRTs, I want to further distinguish them from the crisis teams we're used to hearing about. They are community-led, transformative justice-centered, and have roots in community organizing, and they're volunteer-based. The community-led aspect means that trust is immediately embedded because the people that are creating it, folks already know, and local partnerships are already established. They're not established after the crisis team is already created. They also have community organizing roots, which means that they have even more youth involvement, which really lifts up a lot of the work Whitney Bunce has done with class as part of talking about youth mobile response and the slide that Brian shared earlier. And also they're transformative justice centered. That means they have accountability structures that don't just call police if they see that someone is behaving in an aggressive or violent way. And they don't just call the police if they think that, there's a crime that has been done. They really center healing and not punishment. And it's more than mental health, including it. The last thing that I want to lift up is that often the groups that I mentioned earlier, they're volunteer-based. This means that training is crucial and that anyone can provide care. And they also have low budgets and lower capacity. They're protected by Good Samaritan laws. And what this usually looks like is that they have shifts on weekends or other times when calls to 911 might be typically high, and they use mutual aid to get what they need. So this might mean using Patch or another dispatching app, or sometimes even just a group chat to mobilize themselves towards a crisis that is occurring. But I really think that them being volunteer-based is what makes them autonomous and what makes them able to stay rooted in care. Nevertheless, one thing in my conversations with them that they often need is funding and more support. Next slide, please. But I want to talk a bit about why they often shy away from government funding, and they really lean in towards mutual aid, private funding, or having independent donations. I've learned how many of them seek independent grants and donations. However, I know that if we're actually going to do the work of diverting overt spending on policing onto communities, that this will require receiving some of these funds, but it's the strings attached that keep them away. Independent funding allows them to avoid collaboration with law enforcement and to maintain independent hotlines without integration to any systems that may open up their callers to police violence. They also have unrestricted grants that allow them to respond to crises outside of the commonly discussed mental health sphere, but still may also be mental health crises that are not seen that way because of racism and anti-Blackness. They also are able to avoid surveillance via not having as many data reporting requirements that put them at risk. Many of these things are present in government grants and act as yellow tape to organizations that would benefit from the stability of continuous funding. But even for organizations that aren't as skeptical, they still might not apply because they don't even know that they exist. Governments need to do a better job of making community-based organizations aware of grants. I talk to a lot of our partners at different states across the country, and many times they only hear about notice of funding opportunities after they've already been closed. There's also very infrequently someone to provide technical assistance to apply for these grants so that for organizations that have low capacity. I know that when there's technical assistance available, organizations feel more confident and have their questions answered to apply for grants. So when I'm talking to you all, I really want to share with you all how I believe you all can plug in and help change this. Next slide. Here are some ways that you all here in this group today can support CCRTs. So first of all, for the funders and government agencies that I just spoke to, you can make sure that you are connected to community-based organizations and make them aware of upcoming funding opportunities by conducting outreach and providing technical support. This could even just mean hosting interest meetings where they can learn more about funding opportunities that are upcoming. You can also expand the availability of unrestricted funding so that organizations can pay people a living wage and not just paying for the work, and also continuous grants so that they don't have to keep applying every year. You can also, of course, relax the prohibitive reporting requirements that are rooted in surveillance specifically for these organizations. You can also equip 988 centers with their information so that they can receive some calls instead. A lot of them have these weekend and Friday shifts that they could accept some of these calls for help, especially if a 988 center is aware that they are available to respond. And now I also want to share for the folks in this group who are service providers and mobile crisis teams, this is what you can do to support and also build in diversity into your model. You can hire diverse trainers for your team and pay them well. Consider how racism and bias may impact a 911 or 988 dispatcher and how they choose to direct their call. Critique some of these risk matrices and assessments that embed bias within their definition of violence. Oftentimes, a person actually isn't being violent, but they're being perceived as violent due to bias. And that would lead the risk matrix to assume that law enforcement needs to be involved. However, oftentimes that's not the case. Lastly, create referral programs with local CCRTs that help them build their capacity. Even if you don't agree with their messaging around abolition, you can still receive some of the people that they are connected with that trust them to provide care. Before I close, next slide, please. Before I close, I want to drop some links in the chat for how you can stay connected with me at Raheem, and also how you can get plugged in with us. So I want to draw attention to a position that's opening up with us for a training manager in emergency dispatching. Essentially, we want to build up our training arm beyond our current capacity to further this work, so that organizations, and I'm going to drop these now, so that organizations can have the experience in dispatching and telecommunications. So we are looking for someone with that experience. And if this sounds like a good position to you or someone you know, please apply and share our application link. You can also get a demo of the dispatching app called Patch by going to this link here dropped in the chat. And you can also sign up for the Patch Network if you're a CCRT or wanting to be connected to CCRTs by going to our Patch sign up link in the chat as well. So it was really a pleasure presenting to you. I hope as we move forward that we can acknowledge that none of us are free until all of us are free. That includes people that are seeking care from CCRTs because of their experiences with police violence. Thanks so much, and back to you, Brian.
Wow, Cosette. I can't begin to tell you, and I think you may have seen it already, the profound responses that have been coming through in the chat box. This is clearly something that's about enhancing awareness, but it's also what I love about what you said is the actionable steps that can be taken. Before I go to the respondents, I just wanted to pose a question I saw in the chat box. A person responds that we're struggling mightily with how to fund this kind of response due to the national model that assumes that Medicaid dollars will pay for the mobile response services. Just wondered if you had a comment on that.
Sure. I mean, I think that that's a really big struggle. And I think that we in each of our respective states need to lean on the groups that are convening to create these policies. We have already kind of talked in this group about supporting peer guided models. And this is really, in essence, another one of them. And I think this means, making that policy change, but also leaning on some of these private funders that have a lot of these unrestricted grant dollars, foundations, to see this as something that can act as a conductor for the future of crisis response. And I think those groups and that kind of funding is really what's going to allow us to make this care and make this particular type of crisis team more widespread in the U.S.
And again, Cosette, thank you so much. I know that we're running up on time, and we could probably do more with an hour-long conversation on this. But I want to move to the roundtable discussion at this point in time and bring back to you Vic Armstrong, who's probably already proudly wearing his 988 T-shirt, maybe right on that one, and Shelby Rowe. And I don't know which one would go first. You guys can decide. Who would you like to go first?
I'm going to let Vic go first.
Well, I was about to say ladies first, but I won't pass it up because I'm sitting here about to bust anyway, I think, as I was listening to Cosette. Thank you so much for the presentation and for the work that Raheem does. And I took a lot of notes. They mostly equate to amen, amen, amen. But I will say this is kind of what I took away from that in large part, I think so much of what you said makes sense to me. It resonates with me. But I also think that part of our challenge as we think about how we approach this work is that we need to take a step back and think about why we do this work. I've said before that I think a big problem with our crisis response system for people that are experiencing mental health emergencies is that it really is not designed to protect the individual having the crisis. It's designed to protect the rest of us from the person having the crisis. And I think that also speaks in large part to how people in Black and Brown communities feel about law enforcement response oftentimes, that protect and serve, the question for the Black community often is protect and serve whom, and protect and serve from whom. And so when you think about people that are experiencing mental health emergencies, when you have a system that at its best puts people of color at disproportionate risk, and then you add to that someone is experiencing a mental health emergency where their behavior can be perceived as erratic or unpredictable, it puts that person at even higher risk. And so I think that part of what we need to be thinking about, which is what I think in large part is happening with this work, is that any response needs to be trauma-informed and resiliency focused. And in order to be trauma-informed, you really have to put yourself in the place of the person that's experiencing that trauma. And what this does in large part is that it creates space for influence. And I think if we think about it as creating space for influence, rather than someone's telling us that our approach is wrong, what we've done historically is wrong, what we're saying is this creates space for people who are living that experience to be able to influence how we respond to them when their communities are experiencing a crisis. And I think the other thing about it is that we often miss what's in the ground that brings us to this point. And a lot of what I think Raheem is doing with this work is they are focusing on what's in the ground. The fact that for a lot of Black and brown communities, it's not about disdain for law enforcement, it's about fear of law enforcement. And if we really want to reach those communities, then how do we get around those things? The other thing I'll say is that I loved the part about the information, the safety of the information, because I think, again, we should ask ourselves, historically, the data that we collect, why are we collecting the data? Is it truly to protect the person, or is it because it feeds our systems? It feeds our funding streams, it feeds our databases. But do we really need all of that information in order to help an individual who may be experiencing crisis? And then also with the community response, I really believe that if we go back and look at the way for any states that were successful in moving the needle on the disproportionate impact of COVID and who was getting vaccines and who was getting testing, when we saw the lag in the Black and brown community, the way that we mitigated that was by partnering with the community, by partnering with providers in the community. And there are so many opportunities to partner with providers who have been working in these communities for so long, including the faith-based community that have been working in and with these communities for so long. And rather than working around them, we should be working with them and bringing them on as experts to help to inform the work. And so one last thing, I said that was going to be the last, but this is the last thing. I think the other thing is that, we talk about, when we think about the concept of even community policing, that word community implies that you are a part of that community. And I think that rather than thinking about, this, again, being something that replaces law enforcement, it really is something that supplements it, and it adds that added layer of that community piece. And I see a question about how can we equip faith-based communities to create CCRTs. That's a rich question. I think there are ways to do that. That's a conversation I would love to have offline, but not my day, not my time. Thank you.
Well, I guess I would start by just reiterating, saying amen to everything that Cosette and everything that Vic said. I had made a little list of notes, and Vic, you hit almost every single one of my notes. I think the first thing that I wrote down was, having that community trust. About a year ago, I was in a meeting and Dr. Dolores Bigfoot was in that meeting also, and it was a national meeting talking about 988. And they're like, how do we get Black and brown communities to trust 988? And Dr. Bigfoot with her, she just said, well, you be trustworthy. That's how you get them to trust you. And for many communities, for tribal communities, for Black communities, for trans communities, the services have not been trustworthy. And, when we talk about trauma-informed, Vic, I love, because I'd written down also what I picked up from what Cosette said, talking about Raheem, is their service talks about individual safety. It is the safety of that individual in crisis, where yes, oftentimes the formal response is to protect the community from this person in crisis. And that doesn't feel healing. It doesn't feel supportive. And so I love that Raheem, puts it in that space of, we're here to help you. We're here to protect you, help you. And when we're talking about building out trauma-informed systems, I think we have to talk about race. We have to talk about gender, sexual orientation, citizenship status, and listen when that person that we're helping says, I don't feel comfortable getting help from this system. And I would just ask for all of us to make space for other options like Raheem, and so saying, well, it is our policy. Like sometimes our policies, even though it means well, and I, being director of SPRC, a lot of, pushing and promoting policies. But when we look at trauma informed, if someone in crisis says, I don't feel safe, we need to listen to that and hear that. Years ago, I used to be a director of a crisis center in Arkansas. And I'll never forget, we got a call one day from a family and they were like, we need help. My wife and I are barricaded in a room. Our child has autism and he is severely autistic. He also, is having this mental health crisis. The last time we called for help, he was shot. He survived. We don't know if he would survive another time. Can you help us? Like, yes, he needs help. Yes, we need responders. And there are lots of families across the country in that position. And we shouldn't have to, when we ask at different things, why do communities of color, why are they not seeking help? And I've heard comments, well, maybe they don't understand they're in crisis. And to that, I always have to control my face because I want to roll my eyes. And that's not always appropriate. It's like, of course, they know they're in crisis. And they might have told their grandma, their auntie, their cousin, but they're not going to tell formal responders because formal help has been painful and harmful and fatal to them, their family members. And so how do we make the system safer? And I think it's yes, there is some awareness issues for sure, but I think we still have to talk about the safety issue. Sometimes tribal communities, I loved reading in the side that folks are here of like setting up tribal mobile crisis response because tribal communities, we face high levels of police violence as well. And so having those alternatives and supporting them. So I would say yes to everything everyone said. We have to find a way, with Cosette, I think you're on, if we can find a way to get groups like these CCRTs, certified peer recovery support specialists, to get Medicaid expansion to cover, if you'll cover peer recovery support services, Medicaid could cover things like Raheem. So thank you. I learned a lot and am inspired with what you shared. And I'm so glad that Raheem is there. So just thanks so much for bringing your presentation today.
Thank you, Shelby. Thank you, Vic, for your input there. Cosette, I want to give a special thank you to you. You obviously have opened a lot of thought processes. You clarified points, but you also have opened up something that will create further dialogue, which is what we need right now. I love the fact that you talked about the trauma-informed care connection. I like that portion because so often we forget the piece that all behavior has meaning and purpose if we choose to look in that direction. So Cosette, thank you. Vic, Shelby, as usual, thank you guys for your input. And we are going to move forward. We have a lot more yet to go, but thank you all for your participation. And next slide, please. We're moving now to the lived lens, and I'm going to turn it over to Susie Reese, who's going to speak to us. And Susie, are you there?
Yes, I'm here. Thank you.
Mm-hmm.
Hello, Annyeonghaseyo. I'm Susie Reese. I am proud to be Korean American. So I want to share a little bit about my original journey into this work and then the importance of really expanding our inclusivity practices, particularly for those in the Asian American communities. So I am a child survivor of loss. I lost my father, who was an Army veteran at a very young age, and found myself essentially under guardianship within the military after his loss. I then moved into a rural community in Arkansas and really didn't see myself reflected not only in the community, but also at that time in a lot of the work and the media and so on and so forth. So for me, representation has always been a struggle, especially in the field of suicide prevention. When I really started getting into advocacy and volunteering and trying to find my path forward, I kept looking to the leaders and trying to identify individuals who looked like me, who understood the unique journeys that I had as well. In our community, our primary responders are going to be law enforcement. And when you look at youth who are individuals of color here, especially those who have cultural or language related issues, we often end up becoming the saviors for those who are actually struggling. So an example is, and by state still, if a youth who is not an English native speaker is in crisis, they will actually pull children out of classrooms and ask them to translate. So consider what's going on in that space and how that's impacting not only that youth who's in crisis, but also the other youth. And we also find sometimes that these individuals don't even speak the same language, but there's an assumption that they're going to have an understanding because they're both from the Asian community or both from these immigrant pathways. I think someone, okay, thank you. So I think it's really important in this work that we look at, when we look at inclusivity practices, that we're not just looking at racial and ethnic, we're also looking at some of the things that are right in front of our faces, specifically around language. It's really important to consider that when we're talking about the Asian American community, because there's often this concept that we don't reach out for help, but is the help even an avenue for us if English isn't our first language, or if we don't have a clear understanding of what that process is going to look like? So I really encourage individuals to consider these things, especially in these rural communities like where I'm from, where there aren't a lot of avenues for language, and it's key mechanism for help and for help seeking. So we have to consider these, and we have to consider that lived experience is unique across these communities, even within specific populations like my own. Within our community, especially Korean American, language itself is a trauma experience. It was taken from many of us, especially second generations. So we have to keep these things in mind, because something so simple as asking for help can carry a lot of stress and a lot of trauma and a lot of pain. And I really encourage these spaces to really dig deeper and have some meaningful conversations in as many ways as possible, because it's so important for our communities to know that there's someone like me advocating for someone like them when maybe that hasn't happened in the past. I want to thank you all for continuing this conversation, and I hope that we can continue to grow the opportunities for connection in spaces like this. Thank you again.
Well, thank you, Susie, for really opening things up there. I think just the fact that you've made yourself available, I'm sure you will be getting a lot of responses here. It's so important an element to really discuss regularly. So thank you again for bringing it up. And I'm going to move now to our Samsa report, and we have with us today Dr. John Palmieri. So Dr. Palmieri, will you go forward, please?
Thanks, Brian. Good to see everybody. And thank you to Cosette and Raheem for the excellent presentation today. Really appreciate the opportunity to hear more from you and learn more, and for the space that's been created here today and beyond to talk more about community crisis response. And I really appreciate in particular, specific ways that Samsa and the federal government can be supportive in advancing these conversations, whether that's around funding opportunities and restrictions related to funding, or notification of funding, or technical assistance, or how we're defining mobile crisis. I mean, I think there's a lot of work across this landscape where we can definitely lean in and be helpful. So I appreciate all of that. I just wanted to sort of provide two quick updates. One is a staffing update. As many of you know, we are committed to continuing to grow the office within SAMSA, the 988 and Behavioral Health Crisis Coordinating Office. And so we did just recently add on Dr. Laura House, who's going to be serving as our lead equity and engagement officer. I don't think that she is on this call, but will hopefully have an opportunity to introduce her to all of you perhaps next week. And then I also did want to mention, I don't know if it came up last week, but there is a request for public comment out from SAMSA on national model standards for peer support certification. And so very interested in getting public comment and feedback on the draft standards that have been published. And I will put the link in the chat for anybody who's interested in providing feedback there. I believe the deadline is coming up, it's April 10th, so I guess 5 days from now. And that's it for me, Brian. Thank you.
All right, thank you so much, John, and thank you again for the incredible work that SAMSA continues to do along this round. I'm going to move now to the NASPIT update with Dr. Brian Hepburn.
Thank you, Brian, and thank you to all the previous speakers on this call. It's always impressive. You think that at some point we'll run out of content, but every jam, it's so impressive. So thank you to all the participants who previously spoke. Thank you. I just wanted to say real quickly that in our work, the National Association of State Mental Health Program Directors, our work with the states are continuing to focus on workforce, which is probably not a surprise to anybody on the call. Also to focusing on 988 and crisis services. It's really impressive the way this movement is progressing and is being worked on all across the country. We're getting support, bipartisan support from state executive branches, from legislative branches. It's really an impressive movement, and thank you for all participating. The other issue I wanted to bring up is the Medicaid unwinding. And this is related to COVID. During COVID, as a result of the public health emergency, individuals were made eligible for Medicaid. And as you know, sometimes people go on and off Medicaid because of eligibility factors. Well, during the public health emergency, individuals were presumed to be eligible and therefore were maintained on Medicaid and maintained access to services. At the end of the public health emergency, because of COVID, there will be a determination of whether people are eligible for Medicaid. So all the states are currently working on this issue, looking at how they can continue to provide services if individuals lose Medicaid. I want to highlight, because this is something that should concern all of us, as one of the positives related to COVID was that individuals were eligible, presumed eligible for Medicaid, and that flexibility will be gone. So it's very important for us to pay attention to what's happening with this issue within our states. So with that, let me thank all of you for participating and give it back to Dr. Sims. Brian?
Well, thank you, Brian. And again, for pointing out that incredibly important issue, because it is something we're seeing across all of the states. So I want to move now into the state updates. And Stephanie and Caitlin, go right ahead.
Yeah, Brian, thank you. I'm here. This is Steph Pasternak. Actually, I got a message from Caitlin that she's not available today, so just me for some state legislative highlights. And I wanted to start in Maryland and note that Senate Bill 3 has passed both chambers and now is awaiting the governor's signature. Just a reminder, what that bill does is it puts an additional $12 million into the state's 988 trust fund that they created last year for fiscal year 2025. Also wanted to talk quickly about Minnesota. So Minnesota's legislature has pulled together a couple health omnibus bills, one in the House and one in the Senate. There are some provisions that impact 988 in there, including the creation of a telecommunications fee to support the call center operations. There's also, that fee itself would be between 12 cents and 25 cents, but until that fee kicks in, there is some bridge funding of $4.9 million. I will note also, uniquely, there hasn't been any sort of opposition from the telecommunications industry in this particular state, which sometimes happens with those fee proposals. I will also say within the 988 sphere, there's more funding for mobile crisis teams And in the House version of their bill, 6 hours of continuing education requirements for mobile crisis teams to be trained in children's issues. And finally, just to wrap up here, we're not really able to do state-by-state budget analyses within the context of the map, but I did just want to take a moment to highlight Georgia, since we all know even before 988, that state has been such a leader in crisis response. So they have their legislature has finished their budget process. It's sitting at the governor's desk. There is $2.2 million additional dollars to support the operations of 988, and also a maintenance and expanded funding for mobile crisis teams and new crisis stabilization centers. And with that, I'll wrap up the state update, Brian.
Well, thank you so much, Stephanie. And thank you again for keeping up to date and keeping us up to date on all of the measures that are taking place on this 988 legislation. Let's move now to the next slide. And at this point, I'm going to turn it over to Stephanie Hepburn, who's going to talk to us with Ron Bruno. Go right ahead, Steph.
Thanks, Dr. Sims. So I'd like to welcome Ron Bruno. He's the CEO of Crisis Response Programs and Training. Ron, the article, Mental Health Care Shouldn't Come in a Police Car, published in 2019. What has and hasn't changed since then when it comes to diverting people in a mental health crisis from a law enforcement response?
That's a great question. And to start off, I would want to just kind of echo what Brian said. This has been an incredible session. Learning about the work of Raheem has been fantastic, because if you actually think about it, that's the kind of changes that we're looking for in this country, not only in this country, but truly worldwide. And it is the platforms such as Crisis Now, and especially the Crisis Jam, that brings us together to learn about all of these changes, to be able to help us reform our own crisis response system. So this is exciting, and I appreciate all the work of everybody that keeps joining this session month after, or week after week. There has been a lot of change. It's been a lot of slow movement, but there is a lot of change that we are starting to see happen. And some of those things are due to the 988. It's bringing a lot of attention to crisis response systems, not only at a crisis line level, but what happens afterwards? Who should respond? When we talk about Samsa, introducing the someone to talk to, someone to respond, and someplace to go. I mean, we really got to look at that at each community level and say, what is the best that we can offer? I really liked what Victor brought up, and what Shelby kind of, reiterated, was that when we build crisis response systems, we really look at it from the providers. And when I say the providers, I mean from law enforcement, from the ECCs, the emergency communication centers, from the PSAPs, from the behavioral health side. We look at how's this going to realistically benefit us in responding to help people. But we've got to look at it the other way. We don't need to protect the individual from us. I mean, we need to protect the individual and really build the crisis response system around what's in the best interest of that individual in crisis. And we are seeing that happen. It's starting to happen at 988, and not necessarily only 988, because we look at that as a crisis line. But what we're starting to see is more and more emergency communication centers and public safety access points developing processes and developing policies around triaging calls that are coming into those 911 centers, and making a determination whether they need to send law enforcement or not. And if they don't need to send law enforcement, then they're doing handoffs. So we are starting to see more and more of those centers building those policies, which is a great benefit, because right there, we're diverting from law enforcement, from the criminal justice system, into the behavioral healthcare system. And we are starting to see, such as what we just heard about from Cosette and the great work of Raheem, there are more and more communities that are looking at non-law enforcement response services, or at least the option of a non-law enforcement. And that includes, when we say non-law enforcement, that means no embedded co-response either. So we need to have that option separate, because
Can you explain really quickly what's embedded? What's the distinction there?
Yeah, so embedded co-response is where you take a clinician and put them in the vehicle of a police officer, and then they respond out together as a team to handle crisis situations. Now, on paper, that looks like and sounds like a great model. But if you think about it, all we're doing is really relying on law enforcement again to respond to all crisis calls for service. And we do know that the majority of calls that law enforcement responds to regarding crisis do not need a law enforcement response. You can ask any law enforcement officer that has a history, that's been in the business for 5-10 years, has the majority of calls that you responded to regarding crisis required a law enforcement response? And they're going to say, no, the greatest majority did not. And so that really does kind of set the point that we do need to have that non-law enforcement crisis response option. I mean, law enforcement will always have a role to play in a crisis response system. Absolutely. There are going to be those times where there's going to be a level of danger where we do need the responsible law enforcement to go out and to make the situation safe. But the majority of crisis calls that do go into the PSAPs and the ECCs do not require that level of response. So we're starting to see communities build the non-law enforcement, whether it be, like I said, what the great work of Raheem, or whether it be the Cahoots or the Denver Star, et cetera, where it's built up of different types of disciplines. I mean, some of them are clinicians tied in with a certified peer specialist. Others include a medical component, such as an EMT or an RN to go out and handle the situation, regardless, as long as we are offering an option that does not require law enforcement to be present. And that's where I think we struggle a little bit, especially in this country, is that we do have competing interests, because we do have some federal dollars that are coming in really supporting the expansion of embedded co-response. And we do have law enforcement services that believe that this is the only route to take, is to embed clinicians into their departments to respond out to crisis situations. But to be honest with you, you look at it and what's happening is that those dollars could be spent differently. In other words, instead of embedding that clinician can be trained to be able to respond with law enforcement when necessary, but most of the time they can be responding independently. So we are starting to see a shift. We are starting to see more law enforcement agencies embrace a non-law enforcement option. We are starting to see more ECCs and more PSAPs embrace triaging calls and not just automatically sending that to
and I'm thrilled to see that.
So, I mean, it's really kind of an exciting situation that we're starting to see here in this country. Slowly but surely, we're going to get there.
Thank you, Ron. If there's one more minute, I would just love to ask you, with states and communities that are developing their 911 diversion matrices, do you see any patterns or suggestions were things that states and communities should consider as they build those out?
The biggest thing is that every single call taker needs to have extensive training on crisis call handling. In other words, they've got to be able to identify that they are dealing with a behavioral health type situation, number one. Number two, they've got to begin the de-escalation process if they are speaking to the person in crisis, or many times the individual, the loved one that's calling in, is also going to be emotionally escalated. So they've got to start the de-escalation process there. And then really important, they have got to learn how to triage that call and make the decision. Do we need armed law enforcement to respond, or can we go ahead and do a warm handoff to crisis line services?
Thank you so much for spending this time with me.
Absolutely. Thank you for this opportunity again.
I'll pass it back to you, Dr. Sims.
Well, thank you, Stephanie, and thank you, Ron. And what I'm taking away from this, and this whole day, I've just been so thrilled with the information, is that we are now establishing a network of collaboration that is going to start getting people talking to one another. So Ron, thank you so much for that information, because it does sound very encouraging. And I want to thank Steph for connecting all of this together for us all. I'm going to move to the next slide, please, and just ask if I know that we won't be able to, unfortunately, have any video that we were planning on showing, but I'm wondering if, Sarah, you may have a few words with regards to the federal updates.
Yeah, thank you so much. So we are in 2 recess weeks in Congress in Washington, D.C., but last week, Secretary Becerra of HHS made 3 different appearances before health subcommittees and health-facing committees on the Hill. There were a number of interactions about 988 and the crisis care continuum, and potentially maybe next week or through some of the email materials or in the chat, we can try to share the clip of Rep. Cardenas, who led the 988 Implementation Act, discussing with Secretary Becerra 988 and the implementation as well as the crisis care continuum.
All righty, well, thank you so much for that, Sarah. And yes, we are looking forward to that particular video upcoming. This next slide just kind of points out our Moving America Soul on Suicide, just to point out that episode 9 is coming up, folks. So we want to stay tuned for it and make sure that you connect on that time. Next slide, please. I want to point out for next week, as we're coming up on next week, very, very, very important session that we'll be looking at the LGBTQ populations and 988. And we're going to be favored through Angela Weeks with a presentation on that next week. So we're really encouraging you all, come out, join in next week, be a part of this because it is really moving in leaps and bounds in a good direction. Next slide. Okay, and with that, then we have reached our 1 o'clock time frame. I want to thank all of the speakers, everyone who was a part of the services today. It's an incredibly helpful session, and I look forward to all of you returning again on our next Crisis Jam. So have a great day, everyone.